a law that one of us has to be on the road at all times, Anthony?
As long as we're all in the family.
I'm Anthony. Welcome to No Vacancy Live. That's my friend Glenn.
You're watching the #1 show in hospitality.
Hey, everybody. I'm Glenn Hausman. Thank you so much for watching No Vacancy Live. The incredible Anthony Melchiori's with me. I don't know why I was thrown off on that introduction right now. I guess I was thinking about Norman Lear, who passed away today at the incredible age of 101. But we'll get into that in just a minute. How are you today, Anthony?
I'm very good. You know what he's doing right now? He's moving on up.
I got lots of those puns too, but we'll get to that. All right. I want to get right into it because we got a couple of cool news stories, but we have, I would say, hospitality educational royalty on our show.
Well, you have a PhD. You ran a major university hospitality school. I would say you're pretty much royalty.
The incredible Stowe Shoemaker is with us, former dean at UNLV. Great to see you, my friend. How are you today?
I'm great. It's great to be here, and I'm just honored to be on the show again. So thank you.
This is exciting. So as we mentioned, Norman Lear passed away. And the reason why I wanted to bring it up on today, because his television shows shaped my childhood in the 1970s. And I really think broke down a lot of barriers in society that we're trying to do in hospitality right now. So I just wanted to say that he was an incredible person. I love that he was still learning and thinking and trying to become a better person up until the day he died. Gentlemen, do you have any specific thoughts?
101 years old?
Yep.
Well, if you go on my webpage or my website, there's a saying at the top. It says, put your goals in the atmosphere, and the atmosphere will conspire for your success. I've heard that. I've told this story before, but I've heard that when I was somewhere traveling. I was in bed, and he was being interviewed about his book, and someone asked him, what's your secret? And he looked around and he goes, I don't have a secret. I just put my dreams out there, and the world conspires for my success. I jumped out of bed like a shot, went to the desk, got a paper, wrote it down so I wouldn't forget. And that has become my mantra since I heard it maybe 10 years ago.
Wow. Stowe?
Yeah, I just remember, sort of really all in the family, and Archie and, his wife, and who was really actually a very intelligent woman and an incredible actress, but played this incredible role. And just really the careers that Rob Reiner had afterwards. He was just sort of this actor, and then went on to create one of the greatest movies ever, with the one I can't even think of the name of it, but obviously Harry, but the one where he's reading the story to the little kid and.
Let me tell you, I think it's inconceivable that you can't remember The Princess Bride.
Right, I know.
What, Anthony?
Did he do This Is Spinal Tap or no?
Yes, that was his first. That was his first one.
So you know what I love? This is what I loved about it is that if you watch it today, it's kind of like, wow, you're shocked. But if you watch the other shows that he came out with, the Jeffersons and all those other shows, kind of like even out what you hear on All in the Family and vice versa. So it was a conversation of what was happening and what's happening today and what's happening back then in the 70s, but everybody had their say. Eventually, Edith had her say. Eventually, the Jeffersons had their say. Everybody had their, could defend their position. Yeah. And it was kind of really what you felt like back in the 70s. But if you just watch it in a bubble, it could be upsetting.
Yeah, great shows also that really set, that really broke barriers. Of course, we're talking about Maude, we're talking about Good Times, and the list goes on and on and on. But today, guys, we're going to be talking about Stowe Shoemaker's new book, which he did along with Peter Yesowich. And I've got something to talk about Peter as well, called Hospitable Healthcare. But before we get into changing the world of healthcare by bringing the spirit of hospitality to it. So you are in Las Vegas, right? Yes. And one of the coolest things is we had on recently the Chief Innovation Officer of the TSA. And now Harry Reid International Airport, finally getting used to saying that after saying McCarran for decades. They're going to have a self-service screening now to speed up security process. All right. So this is coming from simpleflying.com. So if you have pre-check eligibility, you'll be able to self-service screening options to speed up your process. And a prototype is going to be trialed next month in Vegas. So it's part of the Science and Technology Directorate's Screening at Speed program, which is partnering with the Transportation Security Administration's Innovation Task Force. It's going to be the quote on it for the program manager, like self-ordering kiosks, fast food, and sit-down restaurants. House passengers in the Trusted Traveler program to complete the security screening process on their own. The passenger and carry-on screening system at individual consoles or screening lanes will reduce pat-downs and bag inspections and freeing time to be reallocated to busier aspects of screening operations. Gentlemen, you're hearing this for the first time. What are your first impressions, Stowe?
I think it's amazing because really, when you think about the hospitality business, think about going to a restaurant. You remember your stay by how good your cup of coffee was at the end of the meal, right? So you've been in Vegas for 4 days. You're having a great time. You're getting ready to go home, and you get killed because you're waiting and waiting through TSA. Now it just adds to the whole Vegas experience of I came, I had a great time, and it was easy to get home.
And so if there's there's one airport in the country I don't want to have to talk to anybody out on my way home, it's that one.
Especially when you're taking a 6 a.m. flight.
Oh my
People
goodness.
are just coming in from the clubs.
Oh, Stowe, I got to take a 6:15 a.m. flight on April 22nd out of Vegas. And as you can tell, I'm already worried about it, being that I know the time and date of that bad boy.
I go for red eye last week, and it used to not affect me at all, and now I have to really think about taking red eyes. But listen, it's the next thing. My concern is, when are they building a new airport in Vegas? Do we know?
2037, Stowe?
Yeah, they've been talking about it for a long time down in Prim. But I think one of the real key advantages to Vegas is you land in McCarran and you're in your hotel within 15 minutes.
Hold on. Where do you land, Stowe?
In Harry Reid.
Okay.
It's my favorite part about that airport is I don't even think about the time it takes me to get to my hotel. I know basically when I land, I'm in my hotel.
Yeah.
But that airport does not do Vegas justice and does not speak to the greater Vegas. And Vegas is one of the greatest places on earth. And I feel like I fly into, a sea airport.
It depends which terminal. I mean, there's certainly Terminal 1 needs to be kind of renovated. Terminal 3 is pretty good. The international terminal is good. Yeah. But we're seeing more and more volumes of people. So at some point, yes, we will have to expand, but they've been talking about it ever since I moved here. So
I believe I don't have the numbers right on my fingertips, but I believe you're having something like 47 million passengers this year going through Harry Reid Airport with a maximum capacity of 65 million. You're now at pre-pandemic levels, or like 99% or something like that.
Yes.
Yeah. The airport's still effective in moving people. It's not like I have a problem. I never have a problem there.
Hey, not only that, let me give a shout out to the good folks over at Harry Reid. They're so good that I very rarely have to wait more than a minute or two for my luggage once I take that leisurely stroll and the quick ride over there. So I love going through that airport. Both ways, I find it very easy and accommodating. Except Delta, no Sky Lounge. Come on. What are you doing to me over here?
What did you say?
No Sky Lounge for Delta.
Yeah,
they have an American Express lounge.
Yeah, I know. That line is really, really long all the time.
I know we had this conversation last week.
We have.
I was just in that lounge last week. I've never seen a line.
Yeah, well, I don't know. You're always flying at weird hours compared to me. I'm always taking like an 11:30 flight out of town because I don't want to get up too early and I don't want to leave too late. But let's talk about Stowe's book. over here,
Yes.
right? So we're talking hospitable healthcare, just what the patient ordered, how hospitality can improve the patient experience. I love that. But Stowe, I got to say something on the record before we get started, and it has to do with Peter Yesowich. Peter Yesowich is one of the few individuals that when I saw speaking on stage back in the day, motivated me to do what I want to do today. I would see him up there and I would be blown away by how effortless and terrific he was. And I looked and I studied, and everything that he did, I thought was phenomenal. So I just wanted to get out there that I highly respect him. And he's one of the few people out there that set me on this course of a new adventure.
Well, it's funny you say that because I have the same experience. I was living in Vermont, working at the Middlebury Inn, and went up to, Peter was doing a seminar up in Burlington. So I drove up to Burlington to hear this guy talk, did a case study. And I thought, wow, that's what I want to do, is go around and be an educator.
Yeah.
And so the same thing, and it's our paths just crossed over our whole career, and we decided to write this book. So it was he's a great man.
That's pretty cool. All right. One last thing, funny coincidence. He was the keynote lunch speaker at the Contemporary Resort for an Interval International event in 2003. And came on stage right after my wife called me and said, hey, we're having not one, we're having twins. So I will forever remember him on stage that day. But Stowe, one of the interesting things is the idea of bringing hospitable healthcare. We saw it a number of years ago where designers really started migrating over. But I think you're talking about something that's a lot more meaningful. Tell us about the thesis for the book.
Well, so it's interesting. So I had written a couple of marketing books earlier in my career, and Peter was the third author on one of those books. And so, we had known each other for a long time, and we ran into each other at a conference. And I said, what are you doing now, Peter? I haven't talked to you in a couple of years. He goes, oh, I sold my agency, and I'm working as the chief growth officer for Cancer Treatment Centers of America. Oh, wow. And I was like, oh my gosh, I've just completed. I've had a joint appointment at MD Anderson, University of Texas, MD Anderson Cancer Treatment Centers, where I was bringing in hospitality principles into healthcare. And we were like, oh, wow, that's amazing. So, we kind of kept in touch over the years, really just kind of talking about healthcare, what he was doing and what I was trying to do with bringing hospitality into healthcare. And then I became dean of the Hospitality College. So that kind of took all my focus. Peter continued working at CTCA. And then about 2 years ago, right before COVID, right as COVID was just really beginning, Peter called me and said, hey, we should write a book on bringing hospitality principles into healthcare. He had seen the articles I had published, based on the work at Anderson. And I said, that would be very interesting. But we both decided, we didn't want to be just two guys with an opinion, right? So we said, if we're going to do this, we're going to do it based on consumer data. We're going to do in-depth interviews with some hospitality executives, with some healthcare executives. And we're really going to take this from an approach that says, how do we make patients feel like loved family members? So when I did the work at MD Anderson, my wife, who did her PhD at Texas A&M, was helping on the project. And we were trying to decide, are they customers? Are they patients? Are they guests? Based on the research that my wife was doing, she said they want to be loved family members. So we said
family members?
Loved family members. Because we don't love all our family members. So we have to put love in the first part. But so we decided to write this book. And what we did is we actually, as I mentioned, we surveyed about 1,200 people who had stayed in a hotel, visited a restaurant, either been to a hospital, a walk-in clinic, or a doctor's office, to find out, because we always think about, we always say, oh, well, hospitality always provides better experiences than hospitals or doctor's offices, but it was all anecdotal. So we said, let's go out and see if it actually is the case. So that's what we did. And then I said we talked to people like Horst Schulze. We talked to some academics who had done a lot of research in healthcare. We talked to Geisinger Health. We talked to people at the Mayo Clinic. to really think about what they were doing for patient experience. And that's how we came up with the book. And I think what's important for the listener to know is when you think about bringing hospitality principles into healthcare, the first assumption is, oh, we're just going to give 4 seasons level service to the self-payer.
Mm-hmm.
We're going to go after the wealthy individual who can pay their own money. We're going to treat them like they're the 4 seasons. And Peter and I both felt that this book had to address the fact that if you stay at a La Quinta, you get great service. If you stay at a Hampton Inn, you get great service, similarly as you stay at a Waldorf. So what is it hospitality does, regardless of what you're paying, you create a great experience. So that was the thesis of the book.
Well, it's, early on, on this show, we've had a gentleman named Bruno Thiessen, who used to be a chef, and he's a Michelin star chef at the Plaza Hotel. And now he is the vice president of culinary at Northwell. And he basically threw all the cans in the garbage. And I asked him on this podcast, I said, what do you do with people that have salt problems? He goes, I don't have that problem because I threw all the cans away and we don't use a lot of salt. So I don't have that problem. So they brought somebody like him into Northwell. And then another friend of mine a long time ago went in. He was in housekeeping and guest service. And now he's the president of one of the largest hospitals in New Jersey. So hospitals have been trying to do this for a while now. And when I was recently in a hospital in May, and I was in the best hospital in New York City and had beautiful room. And I will tell you that the service standard went from 5-star to 3-star, never below 3-star, but 5-star to 3-star, depending on the person.
Right.
It had nothing to do with the policies or procedures. They were as efficient as they could be. It was simply the person. There was different standards for each person.
Yeah, and I think one of the things when we talk about this with people, they go, "Well, that we're a hospital. People don't come here." And when in hospitality, it's a choice of where you go, and
right.
But in healthcare, often it's not a choice. But we're finding that healthcare has become very, very competitive, and people, just like in hospitality, employees who want to work in hospitality do it because we love people, we want to serve, we want to create great experiences. People who work in hospitals choose that because they have empathy, they want to do the best job they can, they want to serve. And it's our role, in my view, to say, as management, how do we give our employees, how do we create the culture that allows them to serve, allows them to do their job efficiently, and not let the rules and policies and procedures get in their way? But then how do we teach people who are in healthcare the basic principles of hospitality so that they can go, oh, now I know when I have that moment of truth with that patient, I know kind of the theory and I know some practical things that I can do to make them feel like loved family members. And we bring those principles into the book.
And I really think it's, my wife's a pre-K teacher, and, you either have it or you don't. I think in hospitality, you have to have it, but there's a little bit more you can learn over a period of time. I think if you're going to be in the healthcare and you're going to be in a hospital, you either got it or you don't, because it's hard. I mean, you have people throwing up on you. You're cleaning people. You're doing surgery on people. It is such an all-in emotional event every single day. Whereas in the hotel business, sometimes you have breathers. In the hospital, there is no breathing. It's just constant intensity. And so how do you, in your book, kind of talk about that? How do you, yes, this is great in principle, but when I'm in the trenches every day, how do I feel that spirit?
So I think it's a variety of ways. One, and I'll use some examples from what we did at MD Anderson, which we tie into the book. So one of the issues for employees is, how am I treated by my other employees? And specifically, how did doctors treat me? So when my work at MD Anderson was in the division of clinical radiology. So I was doing a lot of research with the radiologists, and they said, well, our goal is to read the pictures that the technicians take. So I went down to talk to what I thought were technicians, and they went crazy when I used that term. They said, we're not technicians, we're technologists. And so we changed the way that the doctors referred to the people that worked with them. And suddenly now they were in the trenches, and the technologists didn't feel like they were not important, but the radiologists began to treat them and talk to them differently. So there was a real sense of teamwork, right?
Right.
And so by changing that and creating that culture, it's like in hospitality, when you can always tell a good hospitality person when they're walking through the lobby and they bend down if they're the general manager and they pick up stuff off the floor, right? So creating that sense of teamwork, I think creates, and we did that at Anderson, and it changed the way management looked at staff and the way that staff looked at management, and it created this whole sense of team just by talking about how we talk to each other.
Yeah, I was in the meeting and I said, how do you say that person's name? And they said, we can say it this way, that way. They respond to either one. I was like, well, how does their mother say it? Like, how, when they were growing up, how was it said? It's like, it doesn't matter. He responds to either one. I said, no, it matters.
Right.
Yeah.
It matters dramatically. Like if somebody says, can I call you Tony? No problem. Call me Tony.
Yeah.
I was Air Force, I was Tony. You call me Tony without asking me, completely different vibe.
Or if you're me, you ask and you do not get permission. Plus, I don't think I could call you Tony after all this time.
So that's part of the thing is how we treat each other. I think the other thing is that when we're in the trenches, what are you think about in hospitality, we have the RADAR system, right? Reliability, assurance, tangible, empathy, responsiveness. How do we, by teaching the employees that when at any moment of truth, they have to use a couple of those acronyms to show that the guest is getting great service or, getting quality care. Now, all of a sudden, then the patient begins to say, oh, wow, they are really taking good care of me. So then they become nicer, right? Mm-hmm. So that makes the employee feel better. So we're just like when hospitality, when we're killing ourselves for this convention and the people are like really happy, we don't feel like we're just killing ourselves for nothing. Yeah, and I think that's part of it.
When I was in the hospital, there was, when the person was nice to me and, not overly sociable, very nice, talk to me, I forgot why I was there, and I was stopped worrying about why I was there.
Right.
And there was some times where I went back in the hospital and people weren't as friendly. All I did was think about why I was there.
Yeah, exactly. So how do we create that structure? And really what we talk about in the model is, it was interesting. We went back and we looked at how did hospitality begin to change? And it really began to change with Kermit Wilson, right? When he when he went on that road trip to DC, stayed at all the independent hotels, and he said, I'm going to create a hotel company, and created, of course, Holiday Inn, and, put in the standardizations and all the things we now see in hospitality. And we said, okay, well, if he did that in the hospital, in the hotel business, what is it that he did that really changed the industry, and how has the industry evolved over time?
Right.
And what we realized was that, and this is where we came up with what we call the payer model, because in healthcare, you talk about payers,
right?
We call the payer, we prepare, we prepare for the customer's visit. We anticipate the angst they're going to be feeling, right? We engage with them, we evaluate, and then we reward. And when we looked at that from the hospitality principle idea, we put in all examples throughout the book about what the hospitality industry has done to prepare, anticipate, engage, evaluate, and reward. And we said, okay, well, what are some of the great hospital systems doing right now that do that? So, we talked with Geisinger Healthcare, which has a 100% guarantee. Like if you're unhappy with the way you were served or taken care of, they'll adjust your bill accordingly. And you think about in hospitals, they go, well, we could never do that.
Well, they do. They just double it.
They can think about things. So that was really the premise of the book. And we think that by following those principles, it creates a great work environment. So you're not so much in the trenches, but you're taking care of people.
Anthony, you're muted.
Yeah. And I also think it's important that the staff, nurses, doctors, the more, again, you don't have to give a lot of time, but when you give quality time, we ask less questions because now we connected to you and we're like, that person's busy. They've been so nice to me. I'm going to ask less questions. If you're kind of not giving me my attention, I'm a question guy. I'm going to be pushing that button going, hey. But if you give me quality time, I have a doctor that he gives me good 10, 15, 20 minutes in his office, whatever he does, and that's it. And I can tell he's done. He's got to move on. And I respect that. But if he didn't give it to me, I would probably either go to a different doctor or I'd be a pain in his ass.
Yeah. And when you think about what we've done in hospitality to really spread out the demand, so we have the time to talk to the patient, right? Or we have the time to talk to the customer. We know by using statistics, we can tell how many check-ins we think we're going to have at a given time period. So how do we make sure we're staffed accordingly? How do we bring those principles into healthcare? You think about it, radiology. Everybody wants to get their scan on a Monday morning or a Tuesday morning. So it's packed in the hospitals. Saturday, Sunday, we got lots of demand.
Right.
So we talk about in the book, how do we bring in, tell me what you want to pay for that MRI. We'll tell you when you can have it. Right. Tell me when you want it. We'll tell you what it'll cost. And how do you balance that so you spread out demand by giving the patient choice? And all those things we talk about in the book.
That's fascinating. The idea of variable pricing that kind of makes sense in a non-emergency type of purpose over there. But I was complaining before the show, my arm was bothering me or something like that. So if I just go and I get some pictures of it and stuff like that, it's not really an emergency. And I can be like, I can hang in there till Thursday.
But your PT person was very nice to you and gave you exercises, right?
But the whole thing is you could do it make me feel like I'm in control, right? Because I think a lot of part about when you're in the health system, you're already debilitated in some way and probably not thinking clearly. It's why I'm a big advocate for advocates in that sort of scenario. But I think if you just get that special attention there that we were just talking about, it'll be a lot better for everybody. It's such a smooth out the process and probably make hospitals more profitable, even if they didn't do anything else.
Well, what's interesting about profitability, I'm glad you brought that up, is that the way Medicare is reimbursed is based on what is your scores on what are called HCAPs. And every hospital system is rated on HCAPs, and it's called value-based purchasing or value-based reimbursement. So let's assume that the cost is $1 for the operation, and then the government will send out a survey to the patient who had that operation, and depending upon how well you do on that HCAP scores, you may get 95 cents, 96 cents, or you may get the whole dollar.
Right.
And so there's an incentive to make sure patients are giving really good service. And that's why you see a lot of people entering the hospital space in terms of trying to provide great, bringing hospitality principles in. So a lot of consultants are trying to show how to raise those HCAP scores.
But one other thing, I have a friend who's a doctor in a big hospital, who's a chief in one of the departments, and he just felt at some point it was all about the money, that the hospital was just about the money. And he got a little burnt out. And how do you, but let's go back to maybe a new doctor, a new nurse, a new technician. The thing that is happening today is everybody's blaming that people don't want to work. People want to be rich for doing nothing. They want to be on social media, whatever. And I don't really see it as bad as everybody else sees, because in our day, when we were growing up in this business, it was, there were people that were high performers and low performers and in the middle. What I'm finding is the middle to executive is becoming mediocre, right? So because they're accepting that is what everything is, it's in the air. It's in the air that nobody cares, so it's really difficult. And they're losing their, what I call 5-star baby. They're when they were born, they were 5-star baby, and now they're losing that because of their circumstance. So how do you change that mindset when you're coming into an environment that's intense? It's one of the most intense environments on earth, the hospital, and change. Like I went to all the schooling, I got all the degrees, and I want to do this, but then the business of the business kind of gets involved. How do you change that mindset?
Well, I think it gets changed because now there's information everywhere, right? Healthcare has become very, very competitive. It used to be that you would just go to the hospital right near you, right? Because you didn't really know anything about it. You would talk to your friends. But now with social media, with all these rate your doctors, and information is so available, a patient can go online and in a non-emergency situation, they can find out, get all kinds of ratings about every hospital in the area. So in Las Vegas, we have a new hospital that's opened, and Vegas is a very competitive market for healthcare. So in the old days, there was no competition. Now all of a sudden there is competition, and competition will lead people to be successful. And the hospitals, that person who's kind of burnt out and says mediocre is okay, that hospital is going to lose business because there's going to be a hospital that's going to come in and it's going to have people that are really motivated and are going to provide great service. And so the market, I think, will adjust for that, just like we do in the hospitality business. If the restaurant isn't very good, it goes out of business, right? So someone will replace it.
I know we're getting close to wrapping up. What's the one thing in your book that everyone needs to read? Like, what's the one takeaway from your book that you would say was either an aha moment for you or something that would really, you want people to pay attention to?
I think I want them to pay attention to the fact that the thing that came out in the research, the biggest complaint about healthcare is people don't know what it's going to cost when they go there.
Right.
Right. And so figuring out if healthcare can figure out how do we know what our cost is going to be, how do we let the patient know what the cost is going to be prior to their experience so that they have an idea instead of just leaving the hospital with no idea what they're paying and then being freaked out by the cost.
Why is this an issue when every other business in the universe is able to tell you something up front?
I think it's just because they've never had to worry about that. Right. Because there was no competition. No one ever knew. And people just.
Mostly goes to insurance. There was like, okay.
Yeah, people didn't know. But now, the internet has made people very knowledgeable.
Yep.
And I think that's the big takeaway. And I think the other big takeaway is prepare for the visit. How many times have we gone to the doctor and we fill out the same paperwork that we just filled out every time?
Freaking drives me crazy.
It makes you
crazy. Why is it like a photocopy of a photocopy taken from a 1970s mimeograph? Really?
Exactly.
You can't figure out the iPad thing. So, and just have my records there.
We're not going to the right doctors, my friend. I walk in, man, and they go like, "Oh, you've been here before. Push that button. Yes, no, goodbye."
Well, Anthony, I'm such a picture of health. I haven't been to a doctor since '85.
But I think that's the big takeaway, and just to put yourself in the view of the patient and know that they're going to be angst and anxiety, and how do we change that? And think about the waiting rooms. You go into a waiting room, there's old magazines or HTTV is on, and the walls are all white. How do we create atmospherics? And we talk about that in the book.
I want to ask you a question about that, because waiting rooms are just so industrial. Why aren't they more like living rooms or hotel lobbies?
Because they've been so focused on the clinical aspect that they forget about the whole experience that the guest or the patient is feeling. And at Anderson, we changed all the waiting rooms. I was just down doing some work with Baylor College of Medicine, and they've changed that approach. It's just people didn't think that way.
Right.
Now
Interesting.
There's a doctor that I go to in the city, and he's probably about 5 or 6 other doctors in this office. And you walk in, and I thought I was in the hotel lobby. It's gorgeous.
Right. Awesome.
And then when I'm walking down the halls, it's beautiful. And it's not like it feels like I'm going to a doctor that happens to be working in a hotel.
Yeah. And you can do that very inexpensively. It's not like you have to charge a Four Seasons rate. What's a can of paint cost? And the lesson in the book is that this can be done regardless of how much you're paying and who's paying.
All right. So give us a couple of examples of real low-hanging fruit that should be implemented immediately because it's easy.
Okay. The first thing is preparing for their visit. so that they don't have to fill out the information all at
Yep.
the same time.
Agreed. Love that.
The second thing is to really to thank people after they've visited and said, hey, thank you very much for choosing us as a place for doctor. We found in the research that no one's ever thanked for their business.
Right.
That's a very low-hanging fruit. I think another low-hanging fruit is to people who come in on a regular basis, create almost like a loyalty program or something.
Yeah,
so that
you get the copy of Reader's Digest first.
Yeah. So when I go in, I don't have to stand in line, but I can
Right.
go just check in a separate check-in line for repeat patients. I think is a critical thing.
I think that's really critical because I'm there once a year, but I can imagine how frustrating it is for people that are there regularly that have health issues to go through the same thing over and over again.
And then I think really taking a look at, and I think the other thing is working with your staff to incorporate the RADER system, reliability, assurance, tangible, empathy, and responsiveness, and that whole interaction. So we're not just sitting there looking at our computer, name, record ID, but we're engaging, right? And I think those are simple things that can be done.
Hospitality 101.
Yeah.
Hospitality 101.
All right. So before Stowe, you've earned yourself a great plug over here. Hospitable Healthcare, just what the patient ordered. Stowe, where am I getting my copy?
You're getting your copy on Amazon.com. You're getting it on Barnes & Noble. There's also a Kindle version.
Nice.
And I'm going to be in the process of talking to Peter about making it an audio version.
Oh.
So when you're driving in your car. But we haven't done that yet. But right now, Amazon.com. And we have a website, www.hospitablehealthcare.com, where we have some short interviews with the people that we interviewed for the book and more information.
For the record, I know you guys probably did the audio, but I would recommend Morgan Freeman. I think that'll take it over the top for the audio. All right, Stowe, hang out. And thank you so much for being here. Hospitable Healthcare. I really love that. I took off the wrong one. Sorry, Stowe. I really love being able to talk to him about that and bringing together those worlds. We didn't even get into talking things like biophilic design and other aspects of it.
My favorite part of that was at the end when you came up with the Morgan Freeman joke. It landed in your head, and 5 seconds before you said it, and you were so excited to say it. I could clearly see it in your eyes.
All right, F you for knowing me way too well. And for those of you who want to know me way too well or pretend you don't know me at all, well, you can still get us on audio version wherever you get your podcasts. And if you're listening on audio now, why not watch the video? Facebook, LinkedIn. Of course, all shows are at novacancynews.com. Don't forget to subscribe to our channels. Oh, thanks so much for being here, everybody. We'll be back tomorrow. We have the Chief Information Officer with Citizen M Hotels on. That should be a fun one. And we'll see you then. And until then, remember, you've got one life, so blaze on and
be kind to yourself.
See you tomorrow.